this week's Mansa Kunda with the Ministry of Health. Mansa Kunda was initiated to promote proactive disclosure of information to the Gambian public. It is His Excellency, the President's vision to bridge the gap between the public and the government as far as information is concerned. So the public can get accurate, timely, authentic information so they can make informed decisions, which promotes accountability and transparency, thereby consolidating our democracy. So the government can also get information about what the public is thinking. What is the public mood? What are the wishes of the public? What are their desires as well? What kind of country do they want? Therefore, the Mansa Kunda creates a feedback loop where we bring a sector minister and his entire team or her entire team to interface with the Gambian public and explain to the Gambian public how he is running his or her sector. But also the public can get the chance or the opportunity to ask relevant questions to the ministry insofar as the running of that sector is concerned. So they were a very important ministry. By the way, whenever we have a minister here, we say the ministry is important. Because every ministry is important. But let me just go back, they said health is wealth. If a nation is not healthy, it is not productive. If it is not productive, it cannot build wealth. If it doesn't build wealth, its population cannot live in dignity. So this ministry is important. Today, I welcome the Minister of Health, Honorable Ahmadou Samateh, Ahmadou Lamin Samateh, and his entire staff, who he will get the opportunity to introduce later, to this Mansa Kunda, to discuss with the Gambian people what he is doing in his sector, so we can hold him accountable for his actions or inactions. However, we have to, not me, the entire people here watching, also watching from home, express our displeasure in your ministry coming late to the Mansa Kunda. I suppose that at 8 o'clock, you came at 10 past 8. So I apologize on his behalf. I know it's a very busy season, particularly for the ministry. It's not his fault. He had wished to be here before 8, but he is here at 10 past 8. We apologize. So you don't need to apologize to the minister. I have apologized on your behalf. Mbadingol mbal tentola mbal jela nying Mansa Kunda nyi loku ngokono. Mansa Kunda mo programme dum yalon ko Minister of Information la Sam Mananjang, President la Miro la pour kaje ko banku dingol ni Mansa Kunda filo kanatare timma. Fo ngofa mi yalon ko banku dingol bato ela wasio ela Miro. Anim fanang ilafta min nani la kolya kol. Mansa Kunda sa kalamuta. Bari fana Mansa Kunda salong banku dingol fana be mona kuto, banku dingol fana salong Mansa Kunda be mona kuto. Monela Miroti, monela nganioti. Anim fana monela ferolde pour kaje ko banku dingol sitarano kairo kono. La dinkiral fana itara dinkiral mi yalon sitarano je suturo kono. Bari fani anim foroya kono. Odo nyim programme ngo wole fenam pour kaje ko minister o minister lo kumfla sinani banku dingol sikacha. Afa banku dingol ila secte ba borindi kanyadi le e mon do ko sifalella. Bari fana banku dingol se nyininkarol mi yalon ko fan data ila secteur bundala. Woto nying programme kumata bakele bidung nga mo kumari mbale soro jam yalon ko minister kumari mbalo minister mi yalon ate mara jata kende ya bundala. Mingalon ko jata kende kumata bake ba nim mo jato man kende te fengo fen kenola te do ko kenola ite karanola hani karo fengo minka sabatendi wolon na police ol ni solar le fo jato ze kende ya pour karo sabati woto minister mi yalon ka kumata bake do milbe jambi kana kamabe jambi tentulambe jala mbal kontona bake fam milbe sirinjang kabona cabinet minister ifele sirinjambi na head of the civil service deputy director at the department of press na ambassador mi alon ko lebi jambi kabo China kata fotoki ane UN ibe jambi na senior government officials so fana be jambi ane mom mi alon ko lebi jambi ane media journalist on mbal jala ni Mansa Kunda honorable minister media in la timobe metanto mbejala mbeni mbala bi katabe kumala bake mboke di len dalal si Mansa Kunda mi ngam mom lañ am semaine bi di dalal ki ngam ne mo minister honorable Ahmadou Samateh mo minister mi nga xam mom lañ dinka wërgu yaram gi mo fi ñew tay teewu fi ak ñi nga xam ne ñom la mo liggéeyal ñu waxtaan ak askan bi wax ñu li nga xam ne mom la nekkari liggéey si jawreñ bi nga xam ne mom lañ ko jox moy ministry of health programme bi nag ñu ko jaglal askan bi président dafa wone bu réero am digante askan bi ak nguur gi ba lepp lu nga xam ne askan ba nga ko janku wantel li nga xam ne mooy seen pas-pas li nga xam ne moom mooy seen bëgg-bëgg ak seen xalaat pour nguur gi yëg ko waaye tamit bëgg na tamit li nga xam ne loola nguur gi di liggéey seen liggéey bi seen programme si initiative si ak li nga xam ne moom la ñoo liggéey seen policy si bëgg na askan bi yëg ko moo tax programme bi ñu jagleel ko ñaari semaine bu nekk ñu si benn ministre benn jawrin ak ñi nga xam ne ñoom la àndal ñi moo liggéeyal ñoo toog fi jàkkaarloog askan bi mu wax ñu nu moo doxaleeg secteur waaye tamit askan bi laaj ko tamit li nga xam ne moom lañ ko bëgg a laaj mu wax ñu ko te nag am nañ gan gu màgga parce que ñëpp xam ne wérug yaram lu am solo la te ku feebar doo mun a def dara kon wérug yaram lu am solo la moo tax ñu isi ministre Ahmadou Samateh mu ñoo jàkkaarloo askan bi nuyu ñëpp ñi nga xam ne ñoo fi teew tey gis nañ honorable ministre yi fi toog tey ñi nga xam ne mooy minister of public service mu ngi fi minister of agriculture ministre bi nga xam ne moom lañ dénka jàng ak jàngale bi tam mu ngi fi ñu ngi koy honorable Habibatu Dramé ki nga xam ne moo jiite civil service par mu ngi fi ak deputy chief of staff mu ngi fi director of press deputy ba mu ngi fi senior government official si am fi ak suñ ambassadeur yi nga xam ne ñoo fi nekka ñi nga xam ne ki jógee Turkey China ak UN ak ñeneen ñi nga xam ne tey ñu ngi fi teewu tey kon waxtaan gi tey dina neex dina humba waaw balaa ñoo sori nag lu ñëwee def mooy Mansa Kunda bu passé season 1 dañu bàyyi ministre mu wax ñaari fukki minute wax ñu secteur bi waaye ñu ne wéy di gis bokku si su ñëwee wax bi dañ leen politiciens yi wax rek dañ leen a woon vidéo buy won nit ñi li nga xam ne moom la liggéey si secteur su paree ñu jàkkaarloo askan bi laaj ko nga ma lañ ko bëgg a laaj honorable minister will play the documentary for 20 minutes then we'll open the floor for Q&A jërëjëf.
That is what warranted the construction of this. Under the instruction, the leadership, and the guidance of His Excellency the President himself. So that's why we are here today. By the time this is completed, inshallah, it will be a state-of-the-art infrastructure that will go a long way in ensuring the well-being, inshallah, of the people of this country.
People in country.
Our investments are very strategic in terms of easing the burden of our citizens.
A child's first breath is one of life's most powerful moments. For generations, many Gambian families traveled long distances in search of medical care, especially during critical moments like childbirth.
All this investment is not for any other reason, is to touch directly the lives of the Gambian people. The suffering they are going through to see a nurse, to see a medical doctor, is actually easy.
And for sustainability, for independence in the way we do things.
A child's first breath is one of life's most powerful moments. Many Gambian families traveled long distances in search of medical care, especially during critical moments like childbirth.
All this investment is not for any other reason, is to touch directly the lives of the Gambian people, to make sure that through to see a nurse, to see a medical doctor is actually easy.
And for sustainability, for independence in the way we do things, for ensuring quality, we have to get our own. That is what construction of this, under the instruction, the leadership, and the guidance of His Excellency the President himself. So that's why we are here today. By the time this is completed, inshallah, it will be a state-of-the-art infrastructure that will go a long way in ensuring the well-being, inshallah, of the people of this country.
I think the government has a very good foresight in ensuring sustainability in the health sector. And the best way to do that is actually to train people in country.
Our investments are very strategic in terms of easing the burden of our citizens.
Today, across the country, healthcare services are moving closer to the communities that need them most.
Bakaramuro, Ninsasara, Jaisano Janatarial, Yamur Karamon, or Jenin Casoro, the Canadian era Swokon, or do Boga Jorans or members and Balakokanava, Esi Swokon, a second Tulufula Tulisava, Bokara Karamon, one Naragam Baran, or Belo Plano Sorora, a question.
Janilo Pano Kana, Benyamin no, and be Benyamin Mankelia, Manato Tabas or the Bayutumontulkata Karantabale. Ngata boro nyini je talata o talata sinya killing nin talata sitan ka funtola sitin nga ramuta ni nga ramuta ngata hani moto nata moto nyinga mo konto menta ni o fuo mo sotota hani te be sasari te be wolumo bayila le bo talata o bayila le sai be talata ko tele batula
ar janni moto bina wo wici don tema ni muso kono ya ma waranto mo sasa a ka bata bak parce que taranko ten bulu jant moto jang hani saret atajang.
From regional hospitals to newly established health centers, the expansion of healthcare services is bringing quality care closer to the people.
Karda Musa Sina moto to ya tata boro nyini si jay be laaji fo fanoy par sa man sa tala na ta ko
of the current work in Farato, you will see a huge U-turn. Instead of Gambians going out for treatment, you will see people outside the sub-region coming to Gambia for medical treatment. And that's very soon.
Strategic planning plays a critical role in guiding national healthcare development. Through policy formulation, monitoring, and digital innovation, the ministry ensures that health programs are effectively implemented and continuously improved.
Learning from COVID-19 and maybe a bit earlier, the government of the Gambia, through the Ministry of Health, has also instituted regional rapid response teams in all the regions. So we have 4 sets of people who can respond to outbreaks at the regional level. So these things are just things related to the human capacity. But also, if we go a little bit looking at the systems we use, we've moved to a good extent away from paper-based systems, electronic systems, both for aggregate data, for case-based or individual data, and laboratory data.
Delivering quality healthcare requires skilled professionals, well-equipped facilities, and efficient systems that support patients at every level of care. At the same time, preventing disease and protecting communities remains central to the country's public health strategy.
There's a lot of improvement regarding the functionality of the hospital. For example, now we have our own pediatric. Now, most of the pediatric surgery cases will travel outside the Gambia. And then, that's where they get the care. But now, we do them all here, almost all of them. The position has really helped. Now you have, for example, those who used to go to Senegal, now they can do it here. So this is what it does. Go there, they have to start the test. Not conducive at all. Do it in Gambia, it's less expensive and you have a better outcome.
Across regional hospitals, such as Basse District Hospital, dedicated healthcare workers provide critical services to hundreds of patients every day.
So, beginning with, let's talk about the public health unit. We have the surveillance. So then surveillance was not very advanced. So disease surveillance was limited to certain areas. Coming of we've trained more surveillance officers. Do a survey. Yeah, we have an update of what is going on.
Over the years, if you look at the government budget, you see that the number of health workers being absorbed is increasing gradually, year by year. And this also enables us to be able to deploy health workers more and more into more and more remote areas. So if you look at the officers we have, it has more than tripled in a few years. And because of that, the number of health facilities that have cold chain systems are now over 130.
Francis Small Teaching Hospital, specialized services continue to expand, strengthening the country's capacity to manage complex medical care. Healthcare workers.
So Basse District Hospital is the only see surrounding villages around the Senegal and the border. We don't only see Gambians, we also see non-Gambians. We offer a broad range of services, ranging from obstetric and gynecology services, medical, surgery, pediatrics services. We also art unit, we also have an art unit, also the art clinic. We also see ENT, those that we can manage, they will manage. Those that we can manage, they will send to the next level. Because of is the nerve center, I call it, of the Upper River region, we have a lot of referrals that come in here because it's clear that we have a theater, that cases that cannot be managed in the periphery, that case that needs surgery, that they have to come to the Basse District Hospital to get their definitive management.
Across rural communities, new health centers are bringing essential services closer to families who once traveled long distances to seek care.
Wotumo nintu musomuta nyantari fada banyul ka kundol luasangata dol bu kafuta dol ka wulule dingol ye bang o dol fanay wulu ye dingol tukom o be mu ko la yakol
1996 la sey fi ci sama jox waye lima sey yep ci ciono la nek ngir lan man buma ëmbé kunta yalla ay fajoji buma démé lab esso la démé lab suma ay wasin kunta yalla ay wasine té lol yep ciono la lima dox di wasin yep musuma dugg moto ndax moto yi amut fi benn moto moo fi ne ole yar la mun naa jóg fekk sama taami moto jotut mun naa jóg fekk suma doom feebarut sareet lañ maa takkal sareet bi mun naa nekk sareeti mbaam mun naa nekk sareeti fas bala àgg mun naa loru wala suma doom mun naa lor ndax dal na ma benn yoon maa suma biir bi di métti ma war a dem hôpital pour uti garab waaye coono bi ma jànkuwaate tax na bi ma demee biir boobu noonu fekk maa ngi nekk foo moon dafa mujjoon tuur noonu laa 1 week ñu discharge ma ñëw di naan garab ba bi ma amaatee loolu yëpp coono la woon fii.
ndungu so tawi an ko gerte ndemɗa ko so yeehi ha a yeehi gerte de mbawta dañde haalis so tawi noon ana fawa e nder ndungu wiyete ala haalis a wawata ñawde ɓiɗɗo a wawata ñawdo an e hoorema ɗon ko miijotoɗa ko ñamɗa surtout noon so tawi aɗa ko ñamɗa ha so tawi pawle ari e dow ɓiɗɗo ma walla ari e dow ma ɗum ɓeyrima addan caɗele ɗum wonino ɗo
no tay bo affaire yi aussi ni moo ñu daanaka moo doon tax ñu doon rifaa nit ñi parce que des am na fi fu mu toll nii développement moom yokku na léegi moo gën a baax ni bu njëkkoon waaw léegi moom dégg moo gën a baax ni bu njëkkoon bi loolu amee nag dañ la daan jël yóbbu la Banjul léegi lu bari kar mu ngi dox am nañ docteur te time boobu amuñu docteur waaw léegi am nañ docteur am nañ yëpp loo bëgg toll nii
the numbers have increased. Because especially with the obstetric service, like I said, sometimes we receive some patients up to, though it's a bit far from here, but on some occasions we do receive patients who come here for service. So the numbers have increased. It's increased. Most of our patients are from Senegal. So the equipment of the facility has increased. More patients now than before.
Just services that we do. So we go to trek in all these places. So before I was taking care of all of this, and most of them will go and meet them. So you can imagine before this facility, there was a big struggle, but the community of this facility definitely have been a big relief for the people.
When this new facility brought the healthcare services to we conduct them here with no complications or delay.
It's day today here at Jali Health Center. We just delivered a bouncing baby boy, both mother and child, in good condition. This is why we do the job we do and the services we deliver.
Expanding healthcare services to every corner of the country. In communities like Yang Jali, having a health facility between uncertain
Mendina nyata warta fulo ay na fur le piano to jang ya ja si wulu bulu jang nama wulu ne bulu jang ya sambo jara soma okay ana boro ko tanje isa yako dinni woni fana ni dinni woni problème wala sura sasat le bang ini moro sina nya moto nano ine na fur je na sam okay birwol beketa way nyaaro tal mendina warta
ngalo nyani leptano be karamu e satoto ak karamu ndo dinul mako ila karamu katade bay e ka opportunity di lolale yetol ne ba wotu monu ni tada ni karam do dinno ni shasha ma wala watilo mo be aka fo watilo mo kejele wala mo akada karamu ba alhamdulillah shay mbili ni shoroda ni shasha ma karamu do yenana jalleptano do about 2015 jado ye murna
as the country continues health infrastructure, strengthening resources, and expand care in the Gambia.
We only wherein you can bring your partner or your husband so that men can also be involved is that women are
comment, the impact is that and they can stay with their about consequences that might come. So it's really going to impact a lot of this.
really agree.
Bi mbetunkumun to bi ita amulia no la bila kadobi bi walin kannan anin be nyato ta doron na bije men do hanin lado fadanto ada kelala ko komin ada kela nyato ta baleti ada nda kela nyato ta yirware baleti bana.
With this renovation, our referrals to Bansang are very, very high because for simple procedures, especially CS operations, that cannot be done here because we don't have a theater. With this renovation, now we have a theater. Although it is yet to start, but we are with the hope that if this renovation is complete, referrals that we take on Bansang and in general small house room where
much money we are spending. In country, into other countries for treatment. We are improving.
Every
challenge. Whatever your lifestyle, your next destination starts with us. Visit us at GNPC Petrol Station, Fajura, or contact us at 200-0004 or 782-838-55. Asada Motors. Experience the excellence.
Bell Bottling Company, sharing happiness.
Slow internet can hold you back. Now, the future of connectivity has arrived in the Gambia. QCell's Q-Fiber, ultra-fast, ultra-reliable internet designed for the way you live. Stream your favorite shows without buffering.
A couple of years ago, there was what we call COVID-19, which locked the world down. A virus that no one can see. With all our atomic bombs and nuclear weapons, we could not fight that virus. It shut the world down. That is why I said the health sector, I think, is the most important sector in any country. Honorable Minister, it's time for you to interface with the Gambians. But I'll use the opportunity as the host of this show to ask the first question. We want to build what we call a health sector, which ensures quality health. And to access quality health, you have to open 4 different doors, which in my view, once in place and able to open these 4 doors, you can now access what they call quality healthcare, which is universal. The first door is health infrastructure. I want to ask you, Honorable Minister, since you took over the Ministry of Health, what has been your vision and your achievements in building and enhancing the health infrastructure of this country? The second door is what I call equipment. Because if you build the buildings and there are no equipment, still something is missing. What have you done to improve our stock of equipment, of CT scans, of MRI scans, and so on and so forth? X-ray machines across the country. The third door is what I would call health personnel. Because if you build the buildings, you equip them, then there are no qualified personnel, it is still useless. What have you done to make sure that we build homegrown consultants, homegrown specialists, and homegrown healthcare workers who are competent to serve the Gambian people? And the final door is access to the healthcare facilities. If you build it and people cannot access it, there are no ambulances, then it is still useless, because people cannot access the services. So if you can come to this podium and use 5 to 10 minutes of your time to answer this question of what your minister has done to enhance health infrastructure, to enhance access to the facilities, increase the stock of equipment, but also to build a competent healthcare sector manned by competent people. Mbadingol, mforara tembole to mialon ko minister bina nyinin karol jabila. Nganyinin ka keling sota mialon ko, lafta ay na janding mol mimbijang isi nyinin karo ke. Ngajo ko president ngoy jiko sota do bake. Bawo mo million fulanin talabe gambe bankunkang, doktorol bijane mialon ko bi nsafo ko wol fangoy londo soto Honorable Samateh. But adaji ko aning ala londo president wala je ay tombong ay ke minister. Modi se londo soto bari daji ka kando idaji ko man kendea ela londo te nafala minister don lom yalon ko ay londo soto adaji ko betiata president ngo jiko soto to amu lanna moti ayata ake minister ti akay ko nani health sector tamandinne woto anyanda ka fon tolye bring yake minister ti fo sani ay moneke mialon ko nene ma jolo mialon ko minister mil bije mialon ko wolle benunji ani Mansa Kunda be menunje mialon ko make wala nan kay ko minister nin ka kilimbembulo bawo mbingalon ko jata kende abunda puray timma sinkirnani lo mialon ko wol nande ka timmale wala munti dinkiral nying nkata jaralo ke dameng ngani nin ka minna kabra sita fo sani ay dinkira jumalle lo ani muntolong aning ayelo nyaadile flanjango wala material ti ka fami equipment jorangol ene dinkira lo bungol lo man jorangol keje ale petano man na fasoro nka jorangol ay jimal lesang ani be muntole sabanjango ani wolong na do kulal ngi karandi nyaadile bawo ne dinkiral lo ye jorangol keje bare doctorol man soto woto man ke lopitano ti bungol dronno nka ko sañ e mu nek sim faju maleta ni ferol pour kaje ko mil kanna mol jara ya londo soto pour ka jara loke nani janga wala munti ka foto dinkiral to ambulance sol dong e be nyaadile fo e sorta fo man soto ani ni sorta e be use ka nyaadile nka minister any question o jabi na parta ayala timo introduce bar jandi be jabiro nyinkela timo flo introduce jumano jumat ani mala do ko ministry to yenana question o jabi nim parta nga bunda la ntene ajang ko tenka dante pari da jane sa mbe bolala enim banko dingol alsi jakarlo abarka.
Thank you very much, Honorable Minister. First of all, I start by apologizing for being the cause of the late start. It was a rough day for me, and I want to tell you, being a Minister of Health in a developing country is a rough life. Since I left home this morning from the morning program in this very conference center, I was at the new food and drug lab to ensure that things are going well. Being there till around 6, I got calls of issues with 2 health facilities. And health sector, you cannot say no. You have to deal with that. So, but we sincerely apologize. Once again, I thank you all. I extend greetings and salutations to my colleague, Honorable Minister Sise, but I thank my other honorable colleagues here, Minister for Basic and Secondary Education, Minister for Agriculture, Public Service, Works, Higher Education, and the Deputy Secretary, Deputy Chief of Staff, our distinguished ambassadors are all here, members of the Diplomatic and Consular Corps, senior civil servants are here, ladies and gentlemen of the media, our colleagues from the Ministry of Health. We thank you for giving us this opportunity to have an interface with you, by extension with the people of this country, to say to them how we are carrying the mandate entrusted on us by His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow, and by extension, the mandate entrusted on us by the people of the Republic of the Gambia. So I thank you all for your kind attention. With me here, we have Mr. Sanjay, who is the Acting Chief Executive Officer of the National Health Insurance Authority, the Permanent Secretary, DAMFA, Permanent Secretary 2 of the Ministry of Health, Mr. Issa Marina, who is the Acting Executive Director of the Medicines Control Agency, Dr. Mustafa Bite, the Chief Medical Director of the Edward Francis Small Teaching Hospital, and P.S. Toure. Dr. Toure is the Permanent Secretary 1 of the Ministry of Health. And I have a core of my team. Some are here, or most of them are here, so that just in case the questions are too tough for me, I will pass it on to them. Thank you very much. As you rightly said, Dr. Sise, every sector is important, and I keep on saying that. Before we know it, let one of the sectors not function. It's like every human endeavor is very, very important. So it's teamwork. However, that said and done, before we can do any other thing, we need to be healthy. So that means the health sector is critical. Education, before we can go to school, we've seen people who had food, they have all the resources, they couldn't even enjoy the food because they have cancer of the esophagus, so they could not swallow food. They would look at the food, whatever good food, no matter how good it is. We have had children who ingested caustic soda and it caused esophageal stricture, and they cannot swallow even their saliva. They keep it in the mouth and spit. So what we do for children like that, before the definitive interventions, either dilatation or a surgical operation, we create a hole in their stomach and put a tube, and we'll be pushing food, liquid food, through that tube into their stomach. They'll be seeing other children eat, and they stand and watch, or sit and watch. This is how difficult it is. So that's why we said health is so critical. When he came into office 9 years ago now, what we inherited really was so difficult. We inherited dilapidated health infrastructure. We inherited paucity of equipment. I remember at the Edward Francis Small Teaching Hospital, as a surgeon operating in the theaters, there were times that we didn't have functional monitors. So we operated on patients without a monitor. It's easier to say those days, but that time we couldn't even talk about it. We just kept on pushing quiet. So there were times that we didn't have more than one suction machine in the whole hospital. So the theater would have one. If a nurse had a critically ill patient on the ward, the nurse would rush to the theater to borrow it, because if she didn't suck the secretions out of that patient who was unconscious, the patient could have aspirated and died of aspiration pneumonitis. These were the realities. Now, of course, capacity gaps were everywhere. There was a time in the history of this country when I was the only Gambian consultant, specialist in the public health sector, entire public health sector, and we pushed on. Now we are happy. We have a lot of young ones who have come back, and we are training people, where I'm going to get to the training aspects. So when His Excellency came, he told me, Doctor, we need to do something about it. We inherited something very difficult, but of course, we need to make a difference, because we don't want to be spoken about the same way today we are speaking about the people before us. So we want to make a difference. So tomorrow no one can speak about the way we are speaking today about others. But apart from that, we cannot also continue to cry over spilled milk. It's already spilled on the floor, and we cannot scoop it back. We need to start working and working rapidly to ensure, because health services cannot wait. The person who is sick today needs attention today, not tomorrow. So that being said, but I also went back to him. I say, Your Excellency, you know what, I have a good idea. I think what we inherited is difficult, but maybe you put a stop to every other thing and let's fix the problems of the health sector first. The hospitals, the equipment, the staff. Then we can talk about Honorable Silas roads and the other things. But you know, let's gain wisdom from the Almighty Allah. Then he smiled and told me, Doctor, but if we build all your hospitals will need electricity for your equipment to function. If we buy your ambulance will need roads to carry your patients. So he was trying to tell me in life, in development, things go together. So that is why. And being a developing country where we do not have all the resources, it's a challenge. But within those challenges, with good governance, accountability, commitment, we've been able to do quite a lot. And quite a number of partners did see they're here. If I'm not saying the truth, they'll tell us. But I think they've become a lot more confident in the government and in this sector. That's why we have in partnerships to build infrastructure, to train people, to buy equipment, and so on and so forth. The health infrastructure, because we need to increase access. Edward Francis Small Teaching Hospital was so bad. We had a group of people who came to look at it from Europe. We took them around. That time I was the head of the hospital. Then they looked at the hospital and said to me, Doctor, if this hospital were like a hospital in our country 50 years ago, we can say we can help you to do it. But this hospital looks like a hospital in our country 100 years ago. So that day I was very upset in my heart. Of course, I didn't tell them. I said, but this is what we have. So we have to do with what we have. So we refocused and we said, let us renovate it, let us make it habitable for the patients, and let us make it conducive for the people who are going to work there. And I can attest to that. I'm sure all of you have seen the completed parts. Some of the parts look like they were built for the first time this year. So that is how far we've gone. The polyclinic, that was an eyesore as we entered Banjul. Now it is a modern, beautiful edifice that we can all be proud of. But we have to increase access throughout the country. So what we did, I'm sure you have seen the health facility in Farato. Phase is completed, and inshallah it will be next week, Saturday, by His Excellency the President. This is the first phase of this 1,500 bed facility. It has modern edifices, equipment. For the first time in the history of this country, we have 20 individualized intensive care units, in that facility. As I speak to you, before that facility gets inaugurated and becomes functional, we have only 8 ICU beds in this country at the Edward Francis Small Teaching Hospital, which are not even standard ICU beds. That's the truth. But the new facility will have 20. It will also have a training center and a conference center for the Ministry of Health. It will have a new public health laboratory. It will also have other facilities within that area. But we are also buying a lot of equipment. What happens to this equipment? So we have built a very modern, big biomedical engineering unit that's also at Farato. And then we also train in biomedical engineers. Now, equally speaking, at Farato, because taking care of clinical waste in this country It's a nightmare. I'm sure many of you wonder what happens to the bandages, the dressing, the limbs, the intestines we cut from people. What used to happen was they used to be dumped at the dump sites like any other waste. And we all know the danger with regards to that. And what we have done, we have constructed a modern clinical waste management center at Farato. And equally speaking, there is another one in Edward Francis Small Hospital. We have 7 containerized incinerators across the 7 health regions of the country to deal with medical waste. We equally have 40 facility-based incinerators across the length and breadth of this country to strengthen service delivery. Now, we built, and so you showed some of those facilities here. A brand new facility in Kisimajau, you saw it, Kiangjali, Mansa Kunda, Tumana, Salik, and a huge one is being constructed as I speak to you in Jau. That will be completed, inshallah, and inaugurated by His Excellency this year. We had also built a facility, Brikama, Wellingara, Brikama, Nyambai, Tampoto, Makumbaya, Busumbala. They have health posts, and they inaugurated and functional. And as I speak to you, we've completed 6 health posts in Medina Sancha, Medina Angale, Buduk, another one in Jisadi, in CRR, and Kataba Umar, and also in, what's the other one, the 6th one? I'll remember and tell you. Somewhere in Jokado, is it Balangar? Balangar, yes. So I said, when I miss something, then you will chip in, isn't it? So this is very good, and then we've also secured funding to build another 8, and we've identified the locations for the sake of increasing access. And very soon, inshallah, we'll start the construction of a new hospital in Brikama and Basse. So those are all part of the infrastructural development we are carrying out. But you've also seen that we have renovated and standardized many health facilities across the length and breadth of this country. About 13 of them have been upgraded. But key amongst them is the Biam Hospital. The Biam Hospital has gotten a facelift, brand new expanded sites, increasing accommodation for staff. The clinical area has been expanded, all to the tune of $292 million. A lot of investment in Biam Health Center, in Biam Hospital. What we spent in Biam Hospital is more than all these 5 health centers inaugurated by His Excellency. The cost of them is less than what we spent in Biam Hospital. So I think it's important for us to know the scope of work going on there. Brikama Health Center, equally modernized, and it has a modern theater where we'll be able to do cesarean sections now and improving the health services. So we thank the partners, World Bank, and the other partners who have stood with us to ensure that we are able to do this. African Development Bank, through the Social Protection Agency, is also supporting us in the renovation of facilities like Brikama and other facilities. Chairman is part of that, and other facilities in the URI. So a whole lot is happening when it comes to expansion, and we hope to continue this because we believe people should not travel for more than 3 kilometers without reaching a health facility. But facilities without the equipment are just like buildings. So we've invested, partners, government has invested quite a lot on the procurement of life-saving equipment. We have seen all this equipment that were thought to be luxuries in the past. Now we have them all the way in the provinces. You saw those monitors, you saw those ECG equipment, and a host of them. So we have a lot of equipment now, and of course we are buying more and more equipment. But equipment, as you rightly said, and facilities without the people also doesn't make much difference. So we are building capacity. We are training people. Now, I'm sure it will excite you to know that now we are training doctors to specialist levels in the country. Some of us all had to go out and struggle outside. Believe me, those of us who studied outside, we know how difficult it is, really difficult. If we tell you sometime the kind of food we ate, I ate one bowl of stew for a whole week, warming it every day, and when it forms, I remove the foam and warm it again for a whole week. That's how difficult it is to study outside. So believe me, when we extend appreciation to His Excellency, the President, and the Ministers for Education here, bringing education to the doorsteps of people at home, really, we are not exaggerating it. People going to school at home, eating their parents' food, staying in their homes, believe me, is one of the best things that could happen to any young one. I think you'll believe me. So the medical training, as I speak to you, what we did, we told the partners, World Bank, you are helping us build all these facilities. For sustainability, we have to train our own people. We cannot depend on help from outside throughout because they might get tired. And of course, policies might change in those countries and we may not be able to get those people. Why don't you help us bring experts to the Gambia while they provide specialist services for our people? They help us train our young doctors. And they bought the idea and they brought in up to 20 high-level professors and senior consultants from Ghana and Nigeria, and they help us train our people. As I speak to you, we have over 120 young Gambian doctors who are at various levels of their specialization. Some have completed, some have 1 year to complete, some they are at various levels. So if you estimate in the next 3-4 years, all of those people would have graduated, they would have finished. We would have had this number of consultants in this country. I think this is one of the best things that could happen to this country. But of course, medical work is teamwork. The doctors cannot work alone. Every match, just like the football field, we need each and every player. So we are training the nurses. Nurses are specializing. Public health officials are being trained. Laboratory scientists are being trained. And it's also important for us to know that in collaboration with the Ministry of Higher Education and the UTG, we have now gotten a dental school in this country. And the first batch of dental students graduated. So we have homegrown dental surgeons now. And we've also started a school of pharmacy in collaboration with the UTG. So, Honorable Minister, we are building health facilities, we are increasing access, we are buying equipment, and we are training people to be able to keep those equipment functioning, and we are building capacity when it comes to health professionals to be able to work with those equipment in these beautiful expanded facilities at the end of the day to provide the best of services for the people of this country. This is what we are doing, Honorable Minister. Yeah, you said.
Thank you. So, Q&A, you'll be here, and I will take 3 questions at a time. You'll respond. We urge you to ask your questions in the local languages as well. Those questions asked in the local language will be responded to in the local languages. But, Honorable Minister, if you need any more members of your team to respond to some questions, they are welcome also.
Thank you very much.
Yes, thank you so much, Honorable Minister. Unfortunately, I want to ask a question in a local language. My name is Matar, working from Auto Network. Minister, lu ma la bëgg a laaj question ñetti question la ba naa def ñaar. Recently, gis nañ ne soo demee si health center yi gis nañ ne prices yi dafa yokku torop si wàllum soo duggee foofu medical yoo war a jënd après soo paree docteur la bindale ba pare. But unfortunately ñu bëri dañoo fay xaalis bu bëri ba dee am medical. dañ ne boo dama si pharmacie bi nga jënd ko out of spending more than 500 or 600 or 1000 plus. So bëggoon nañ xam yow sa ministry bi lu tax bring in that kind of xaalis ba nga xam ne ñu ngi koo fay ba pare medical hospital yi. Beneen question bi gis nañ ne recently yeneen dëkk ñi nga ne Ebola mu ngi xew but unfortunately gisun si sa ministry ngeen ñëw wax ñu ne yéen measures yoo xam ne loolu ngeen prepare pour jël ko immigration pour mu ne cover border yi bëgg na ñoo xam foo toll est-ce que def ngeen loolu ak immigration yi or not. Last question bi
Thank you very much, Honorable Minister. My name is Shah Omar Silla, former staff of the Ministry of Health. And I want to say congratulations and thank you to your staff for the National Food and Drug Quality Control Lab. We celebrate you. One, I just want to understand what will be the operations framework for the new National Food and Drug Control Quality Control Lab. In consideration, would you mind to collapse the MCA and the FSQA into a single unit of a directorate headed by a Director General, while the two units maintain their operational Second, 10, Honorable Minister, what would you to be the milestone for the implementation of the National Health Policy 2021-2030? Thank you.
Good evening, Honorable Minister. My name is Bubakar Jabi, President of Iowa Students Union. So I actually want to ask you something. If by any chance you were to retire today, what would you say is your biggest achievement, and what advices or suggestions will you give to your successor to move the health sector to a level that you did not reach? Thank you.
Yeah, thank you very much. Thank you from our brother from Fatu Network. Thank you very much for that question. But I think it's very important for us to recognize the efforts government is putting in the health sector in the Gambia. I'm sure you know health service delivery is highly subsidized in the Gambia, highly. In fact, the most subsidized. You had one of our people say in SL here, they get a lot of patients from Senegal. And it is like that across the length and breadth of the country. When you go to Soma, when you go to Bansang, when you go to Basse, when you go to Sabi, when you go to Koina, that. Why do people come here? Because it is much, much cheaper. And sometimes it's also important, I'm going to answer what government is doing, but I think in life it's also important to know what prevails in other places. When I was training in Nigeria, when a patient gets to the hospital and they have much more resources than us, you know, as young doctors, we will look at the patient, we call clerk, and we think maybe this patient has pneumonia. We wrote everything down, syringes, cotton wool, normal saline, the drip set, injection syringes and needles, the cannula, even cotton wool and plaster. We used to write it for them and give the paper to the parents to go outside the hospital to buy. They'll come with big bags, and then we start, that's the time we start applying those for the patient. This is reality. Ghana is exactly the same. You can find out by yourself. We certainly don't want Gambia to ever reach that level, not because we are better, but we know, we understand the plight of our people, and His Excellency is very, very, very particular about his people. Anything government wants to do, his first question is, what is going to be the impact on the people, especially the ordinary person? That is exactly what he asked. But of course, you have also recognized the fact that the very free services is also not sustainable. Gambia is a developing country, and you know our resources are limited. The increments that you have seen in fact, are still highly subsidized. They are not close to the cost value. I will also encourage you to look at the cost of services, the cost of an operation, goes into an operation, for example. The drugs, anesthetic drugs that are used, the antibiotics that are used, the fluids that are used, everything that is used. Believe me, when you do the calculations yourself, you will know that government is doing quite a lot. The challenges we have sometimes with shortage is because Gambia is a small country. We don't manufacture any of these medical items. Except now, we're happy that we have plants that produce oxygen, and I think the government and the partners should be commended for that. Because before COVID-19, thank you, before the COVID-19 pandemic, we didn't have a single oxygen plant in the health sector in this country. And there was, thank you. But now, we have up to six containerized oxygen plants in this country. Bansang in CRR has a whole containerized oxygen plant. I think this is how far we have gone. This paracetamol, the fluid, everything we use in the health facilities in this country have to be imported. And how do we make sure we get them? When we get the allocation, before we get the allocations, these are tendered, suppliers show interest, it goes through competitive bidding, they are paid advances, they are supposed to deliver, but because they bring them from out, we get excuses of delays in shipment and so on and so forth. So it is not an easy task, but government has put up strategies. And just to show you how important His Excellency takes this, he has set up a special cabinet subcommittee to support